Admission for EEG monitoring. Hello, and welcome to Boston Children's Hospital Neurology and Epilepsy Services, a place where we try to understand if your child is having seizures and what kind, so we can come up with the best plan to manage them with your neurologist. If your child is having events possibly related to seizures, your neurologist may schedule a hospital stay to try and record these events on EEG. The hospital stays typically last 1 to 3 days, depending on how often the events are happening at home. What happens during hospital admission? You will check in at the admissions department on your scheduled day and time of admission, and they will help you get to the neurology floor. Once you arrive at our front desk, you will be directed to your child's room. A nurse will come and get you settled in. He or she will review your child's medical history, medications, complete a brief physical exam, and vital signs. You will always have a designated bedside nurse who will change shifts about 2 to 3 times per day. An EEG technologist will come and place the EEG, which will continuously record brain waves, audio, and video in the room throughout the admission. If you would like to learn more about this, we've created other videos about getting an EEG placed, one for parents and one for your child to watch. You will meet the team throughout your stay. We will see you and your child 1 to 2 times daily on rounds. We have many providers on our teams that all work together to provide the best care, including resident doctors, nurse practitioners, fellow doctors, and attending doctors, or the doctor in charge. The parent's role. A parent or guardian who is over 18 and who knows your child's seizures and spells must stay at your child's bedside throughout the hospital stay. Many families share the job of staying with your child and have 2 adults alternate shifts. Rooms have a pull-out chair for one parent to sleep on. The parent gives consent or permission for tests and procedures during the hospital stay and helps point out seizure events. The parent writes down descriptions of what happens during your child's events, including the times they happen, and presses an event marker button to note the time that they happen. This is very helpful to the doctors when reviewing the EEG. Sometimes longer seizures happen that do not stop on their own. If this happens, our team is ready to give medication. There is an emergency button in the room you can push, and the doctors and nurses will come in right away to help your child. We understand that it can be hectic and scary to have many people rushing into the room, but acting quickly helps us make sure that we can give the care and medication needed to your child. What happens after the admission? When it is time to go home, the team will review all the results with you. We'll share them with your child's primary neurologist as well. Together, we will create a treatment plan. Thanks for joining us. Questions? Call us at 617-355-7970 for the Epilepsy Clinic or 617-355-6388 for the Neurology Clinic.